Hello, everyone. I want to welcome you today. I'm here with a special guest. This is Heather Sawyer, and when we talk about topics such as mental health, it's always good to talk with somebody that is on the ground, that is in the field, and that works with different situations and circumstances every single day. So, Heather, thank you so much for being here today.
Thank
Could you
you.
share just a little bit about who you are and a little bit about your background?
Yeah, well, thank you so much for having me. I'm
Yeah.
so excited. I love talking
Absolutely.
about this.
Yes.
So I'm a pediatric psychologist at Blank Children's Hospital. I've been there for almost 10 years.
Wow.
And I'm also starting my own venture of a private practice in Norwalk,
Okay.
serving children and families.
Awesome.
So I'm so excited to talk about this today.
So chances are you work certainly in the pediatric world, but also encountering a lot of families. And so I'm guessing
Absolutely.
you see the interaction between young and old and different seasons of life.
Yes.
For sure. So one of the many reasons that we are talking about this today, one, is just an important topic to cover that often doesn't get discussed at church, but also because of the world that we're living in and the last 2 years of what we've been through as a culture and all of the effects that COVID has had beyond just the disease itself. What have you seen in your profession in the last couple years in terms of mental health?
You know, I think we are just getting our heads wrapped around it. From the beginning, I think all of us had concerns, right?
Yeah.
Obviously, there were the physical concerns about COVID and what that meant from a health perspective.
Right.
But as a child psychologist, I've always been concerned, how is this affecting our kids? How is this affecting our families?
Yep.
And what we've seen is that the impact has been profound. All of the different changes, the social isolation. As we know, we're not meant to do this alone.
Yes.
And so,
Yes.
Being secluded, children doing school from home, parents are trying to be teacher and full-time, parent and work
Right.
their job. And
Right.
it's a lot. So we're seeing increased rates of burnout, both from a parent perspective, but then also people in their jobs.
Yeah.
And so rates of depression and anxiety have at least doubled, if not tripled. We're seeing things like increases in suicide in kids.
Yeah.
It's been really devastating in some ways.
Yeah. So for people to say it's not a big issue, you would beg to differ because you're living in this every day. And I think that kind of leads into some of the assumptions or misunderstandings that people have about mental health. For somebody that's in the profession, it's not new. But I think about the different aspects of health that we've been covering in this series we've been in. Certainly spiritual health, I don't think anybody would argue with. We want to have a good relationship with God.
Absolutely.
I've never met anybody that has judged somebody for wanting to be physically fit or to eat right. We don't get judged for wanting to go to the gym. And yet, for some reason, when somebody goes to see someone in your profession, there are stigmas around that. What are some of the fears or the stigmas that you encounter when you talk to people?
This comes up a lot working with kids because kids pick this up. They hear adults talking about it. They hear other kids talking about it.
Yeah.
So one of the most common things that I will hear kids say to me is, "I'm not crazy." And I think that is a stigma that is carried not just with our kids, but I think as adults too.
Right.
There's this belief that if you only go to see a therapist if you're crazy.
Yeah, I've got big issues.
You must be so terrible.
Right.
You must be so messed up that you have to go to therapy.
Right.
And the reality is that's just not true.
Yeah.
Therapy, of course, I'm biased, but I think therapy is beneficial to everyone. I think
Yes.
we could all benefit from it.
Yep.
And one of my favorite things to tell my kids that I'm working with in therapy is, hey, guess what? I have a therapist too.
Yeah.
And
the therapist
and they're
has
like,
a therapist.
They're like, what?
Yeah.
I'm like, yes, I need a helper too. We all need helpers, and that's okay.
Yes, absolutely. Well, I think we were talking before. You used the analogy if you're injured or if you're sick, nobody bats an eye about going to the doctor, going to the clinic, and yet for some reason we think that our mental health is maybe not as holy or spiritual as our physical health or spiritual health. And so I'm glad that you made that distinction as well. And I think almost even as Christians and those of us in the church, there can be some added stigmas or barriers because of some of, I don't know if it's weird theology or false teaching that's out there. I have heard it said, and sometimes what I hear people saying is, well, mental health is more just sort of made up because we just need to pray more or have more faith or think happy thoughts, be a little bit more positive.
Yep.
As somebody that's in the field, as a professional, how would you respond to that?
Oh, that's so hard.
Yeah.
You know, one of the things that I think is so helpful to understand is when we tell someone, oh, don't worry about it.
Yeah.
That is so invalidating of their experience.
Yeah.
You know, we're saying to them, like, what you're going through, what you're struggling with, it's not a big deal.
Yeah.
And that's not what we mean. You know, we've all been in a situation where we've kind of flippantly said something like that.
Yeah.
But I think it's important to recognize that, no,
Yeah.
you know, if somebody is struggling with something, if they're praying really fervently and they're still really struggling with it, there's something there.
Yeah.
And that's valid and that's real.
Yep.
And I think it's the bravest thing to be able to move forward, you know, coming to someone like you or going to a mental health clinician and saying, I'm really struggling with this and this is hard.
Yeah. Yeah. It takes somebody that's strong
Absolutely.
to admit that they need help. Where I think a lot of times the assumption is I'm weak. I have a major issue, like you said, if I'm going to go reach out for help. Mentally.
Yeah. One of my favorite clinicians is Brene Brown.
Yeah.
And I love listening to her talk because she's so great and she's so real. She's authentic.
Yes.
And what she found in her research was that the happiest people are vulnerable. Meaning they're able to, you know, be honest about what they're struggling with. They're able to say, hey, I'm not good at this, or hey, I'm struggling with that. And because of that authenticity, they're able to be vulnerable, they're able to be real, and then that allows true, authentic connection with other people.
Yeah, that's really good. So what I hear you saying is, if I want to find that abundant life that Jesus offers, it's not by pushing these things aside or shoving my feelings and emotions under the rug, that the more actually we can do that, we become more human, and then we can discover, you know, the healing and the joy that we believe that Jesus offers. And so there's that link between spiritual health and emotional and mental health is all kind of one and the same.
Just
in that way.
mind, body, spirit.
Yes. Yeah.
We can't piece it all out.
Right.
You know.
So I'm curious, there are probably those that are listening to this that either they themselves have encountered some struggles in the world of mental health, or they have a family member in all different levels of severity. What would you say to somebody in terms of a next step for them as a professional? I'm struggling with this, or I have a family member that's wrestling with this. How do I know when, hey, I just need to talk about it with a friend. I need to spend some more time with God, which we all need to do. Or when does it reach that point when you would recommend, I think that maybe you should go see a professional?
Yeah. I mean, that's a great question. And it is by no means the same answer for every person. But I think there are some things that we can all kind of look at. You know, certainly if you're noticing changes in your relationships, changes in your sleep, changes in your eating habits, your energy level. If you're noticing you're more irritable, you know, whether with your spouse or your children or at work. You know, if you're starting to notice some of these changes, and maybe you already have tried to talk about it with someone, and it's just, you know, this isn't just like you're having a bad day. This is something you've been really noticing over the last week or maybe even months. That is a really good indication that, hey, it might be helpful to talk this through, to figure out what's really going on. And the reality is, when we're struggling with something now, it doesn't really relate to just what's happening right now. It's usually the things from our past that are kind of have caught up with us. You know, there's whether it's things from our childhood or just living 2 or 3 years in a pandemic. You know, it adds up, and it gets to that point where we feel like, okay, it's too much. But really, if you're noticing those changes, that's important. That's a big deal. And
so pay attention to your feelings.
Yes, absolutely.
I think a lot of times, particularly as we were talking about in a religious setting, in a church setting, that somehow we think that we have to put on a happy face. and everything has to be
We're
everything has
great.
to be okay.
I'm good.
Yeah, and I love the fact that you, as a follower of Jesus, are also in this profession, and that you found that link as well, and that as Christians, that maybe we're the ones that should be the leading examples of vulnerability in that. So yeah, I guess that's my final question for you: is where do you see the link between following Jesus, having a really strong faith, and yet taking mental health seriously?
Wow. I mean, I look at Jesus as he was like our first counselor. You know, he came, he brought all these people together who had all these issues, right? They were, you know, they had been shunned by their communities. They were considered to be, you know, not good people.
Right.
And he brought them in and said, no, you're good enough. You have value, and God sees you and he loves you.
Yeah.
And I'm going to teach you these things, and I'm going to help you to see the gifts that you have.
Yeah.
And then I'm going to send you out. And I really see that's what therapy does. You know, when I'm working with kiddos and families, I'm really trying to help them see what's already there. I'm not giving them anything.
Right.
I'm not changing them. I'm not fixing them.
Yep.
I'm truly just helping them realize the gifts that they already have, and then showing them how to be the light and carry that out.
Yeah, I love that. You know, when Jesus sent the Holy Spirit to us, the Holy Spirit is often referred to as the wonderful counselor. And I think that's an awesome connection. So Heather, we've talked about a lot of different things today. If there's anybody out there that is feeling this tug on their heart that, you know what, I'm tired of hiding, I'm tired of dealing with these emotions alone or struggling, or if there's somebody in my family, what would you recommend coming out of this weekend? What would you recommend as some next steps for them to get the help that they need?
I think if you're feeling that pull, do it. You know, and there's a lot of different pathways that a person can take. You can reach out to your primary care doctor. Sometimes they might be able to connect you. Certainly, if there's other things that they want to talk to you about. You can also just directly connect with your insurance provider. They have providers that are in network, and so they can get you a list so that you can just directly reach out to them. There's Psychology Today is a really great resource for therapists. You can type in your community, exactly what you're looking for, and it will pop up with a number of different clinicians who specialize in exactly what you're looking for. Or, you know, coming to you guys here at Hope. You guys also have great connections in the community, and so reaching out to you, and even employers. There's a number of employers who have employee assistance programs and therapy options that way. So there's a lot of different pathways. So definitely don't let, you know, feeling like there's no one out there be a barrier, because there absolutely is.
Yeah, a lot of people put up those barriers. We want to remove as many of those as possible. And you're right, we do have a lot of great professionals like yourself that we know and are comfortable with within the larger Hope community. And so people are more comfortable coming to their pastor or a primary care physician. We just want to remove those barriers as well to get people the help that they need. So you listed a lot of great examples there as well. So thank you so much for your time today. I know there's so much more we could go into, but just want to thank you so much for everything that you do for children and families and for our community as a whole. You guys are so underappreciated in what you do. So
well, thank you for having me here and letting us talk about this, because I think this is really important.
Absolutely. Thanks again.